Hello and welcome. Today we're diving into a rare and complex neurological disorder, autoimmune autonomic ganglionopathy, or AH. This condition targets the autonomic nervous system, the unsung hero that silently regulates crucial bodily functions. Join us as we unravel the mysteries of AH, from its causes and symptoms to the latest in treatment and research. The exact cause of autoimmune autonomic ganglionopathy remains elusive, but the prevailing theory centers around autoimmunity. In AH, the body's immune system mistakenly identifies its own autonomic ganglia, clusters of nerve cells outside the brain and spinal cord, as foreign invaders. This misdirected attack leads to inflammation and damage, disrupting the normal functioning of the autonomic nervous system. While the trigger for this autoimmune response is often unknown, researchers suspect links to preceding viral infections, underlying autoimmune conditions, or even certain medications. Specific antibodies, particularly those targeting the ganglionic acetylcholine receptor, or ganglionic HR, are frequently found in patients with AAG, further supporting the autoimmune nature of the disease. Let's delve into the pathophysiology of AH. The autonomic ganglia act as relay stations, transmitting signals from the central nervous system to various organs and tissues. These signals control vital functions like heart rate, blood pressure, bowel and bladder function, and even sweating. In AH, the autoimmune attack damages these ganglia, specifically the ganglionic acetylcholine receptors. This damage impairs the transmission of nerve impulses, leading to a cascade of disruptions in autonomic function. The severity of symptoms often correlates with the extent of ganglionic damage. The inflammatory process and subsequent neuronal dysfunction contribute to the diverse range of symptoms observed in individuals with AH. Autoimmune autonomic ganglionopathy is a relatively rare condition. Due to its rarity and the fact that symptoms can overlap with other disorders, determining the precise prevalence and incidence can be challenging. Studies estimate that it affects approximately 1 to 2 individuals per million. AH can affect people of all ages, but is more commonly diagnosed in adults, particularly those between the ages of 30 and 60. There doesn't appear to be a significant difference in prevalence between men and women. The symptoms of AH are as varied as the functions governed by the autonomic nervous system. Orthostatic hypotension, a sudden drop in blood pressure upon standing, is a hallmark symptom, leading to dizziness, lightheadedness, and even fainting. Gastrointestinal issues are common, including nausea, vomiting, abdominal pain, constipation, or diarrhea. Bladder dysfunction can manifest as urinary retention or incontinence. Some individuals experience excessive sweating, while others suffer from the opposite, a lack of sweating. Blurred vision, dry eyes and mouth, and difficulty with pupillary constriction are also frequent complaints. Fatigue, exercise intolerance, and even cognitive difficulties can also occur, significantly impacting quality of life. Diagnosing AH requires a comprehensive approach. A thorough medical history and physical examination are crucial. Blood tests are performed to detect the presence of ganglionic acetylcholine receptor antibodies. Autonomic function testing, including tests like the tilt table test, sweat testing, and heart rate variability analysis, can assess the integrity of the autonomic nervous system. In some cases, nerve biopsies may be performed to examine the autonomic ganglia for signs of inflammation or damage. Ruling out other conditions that can mimic AH, such as other autoimmune disorders, infections, and neurological diseases, is also essential for accurate diagnosis. While AH isn't typically classified into distinct subtypes, the severity and specific presentation of symptoms can vary significantly from person to person. Some individuals may experience a rapid and severe onset of symptoms, while others may have a more gradual and progressive course. The predominant symptoms, such as orthostatic hypotension or gastrointestinal dysfunction, can also differ, influencing the treatment approach. The primary goal of treatment for AH is to alleviate symptoms and improve quality of life. Immunosuppressive therapies, such as intravenous immunoglobulin (IVIG) or plasmapheresis, are often used to reduce the autoimmune attack on the ganglia. These treatments help to lower antibody levels and suppress the immune system. Medications to manage specific symptoms, such as midodrine for orthostatic hypotension or medications for gastrointestinal problems, are also prescribed. Lifestyle modifications, such as increasing fluid and salt intake, wearing compression stockings, and avoiding prolonged standing, can also help to manage symptoms. Physical therapy may be beneficial for improving exercise tolerance and overall function. Currently, there is no known way to directly prevent autoimmune autonomic ganglionopathy. Because the exact cause is unknown, preventive measures remain elusive. Focusing on overall health and wellness, including maintaining a healthy immune system, may be beneficial. Being vigilant about any unusual symptoms and promptly seeking medical attention can facilitate early diagnosis and treatment, potentially limiting the long-term impact of the disease. The prognosis for individuals with AAG varies. Some individuals experience significant improvement with treatment and can achieve a relatively normal quality of life. Others may have persistent symptoms despite treatment, requiring ongoing management. Relapses and remissions can occur. Recent research has focused on identifying more specific autoantibodies that may be associated with different clinical presentations of AAG. Researchers are also exploring novel therapeutic targets that could provide more effective and targeted treatments for AAG. Further research is needed to fully understand the long-term course of AAG and to develop more effective strategies for prevention and treatment. Understanding the intricacies of the immune response in AAG is vital for future therapeutic advancements.